You're listening to the Assembly on Environmental, Occupational, and Population Health podcast.
Hello, and welcome to this podcast from the ATS Environmental, Occupational, and Population Health Assembly, EOPH. I'm the podcast host, Joanne McKell, MD, from Case Western Reserve University School of Medicine and Web Director of the EOPH Assembly. And I am pleased to introduce Dr. Erika Moseson, MD, MA, creator and host of the Air Health, Our Health podcast and its companion bilingual blog. She's the pulmonary section chair at the Legacy Emmanuel Health Medical Center, a member of the ATS Environmental Health Policy Committee, podcast host for Breathe Easy, the ATS podcast, full-time pulmonary and critical care physician, and member of the EOPH Assembly. And this probably should not be mentioned last, a wife and mother of 3 children. So welcome, Dr. Moseson, to the EOPH Assembly podcast. Thank you so much for joining us today.
Well, I'm excited to be here. I love the EOPH Assembly.
So do I, actually. Tell me about yourself, your background, how you decided to pursue medicine, the background, the big picture.
Yeah, well, so I grew up in the beautiful Pacific Northwest. I was actually born at the hospital where I currently am the pulmonary section chair, which is Emmanuel. So when I used to attend at the ICU there as well, and now I do my ICU at a smaller community hospital. But I'd always tell them I outlocaled the locals. In Oregon, we're very into people being local. And I said, well, my mom was in the ICU here before I was born. So
wow.
So yeah, I grew up in the Pacific Northwest, loved it. Always kind of liked the humanities and the sciences. Went to college and was a little bit torn on humanities and sciences. And I had some very good advice from actually I at one point in my life thought I was going to be doing a degree in religious studies, and I had some good advice from a religious studies professor, Arnie Eisen, who I'm sure does not listen to this podcast, who told me that I was somebody who needed to do something during the day that was concrete, and that he thought that academic humanities may not be very helpful for someone who needs to have something concrete at the end of the day. And I realized that was very true and very insightful. And it was one of many conversations that kind of swung my interest back to science. I had done a minor in human biology, and I had been doing cancer research throughout, doing CML research at the Drucker lab up in Portland, Oregon. And then I went to Germany and did CML research in Germany, in Heidelberg, while I was applying to medical school. I went to medical school, loved it in New York, and then medicine residency at UCSF, and then pulmonary critical care back in my hometown of Portland, Oregon.
Wow. I think that does count as being concrete. Yes.
Yes.
So you speak German as well as Spanish? Is that true?
Yes. Yeah. So my mother's family, I used to say she's Mexican American. It's a little interesting. I mean, her family's been living in the same part of the United States for over 200 years, which initially was part of an area of the world colonized by Spain. So people spoke Spanish, and then the border crossed them, and now people speak English. But she grew up speaking Spanish in a little town called Deming, New Mexico. And then she had moved to Oregon. She was an OBGYN, and she fell in love with the beauty of the Pacific Northwest. That's where she met my dad. And so, yeah, and then we also speak Spanish at home. My kids sometimes make fun of my accent because I did learn it. My parents didn't really speak it that much growing up, so I did learn it later. But yeah, we try to speak Spanish at home. They're definitely in a phase of not wanting to speak Spanish at home. So
yeah, well, being bilingual, trilingual, it all works very well in terms of developing those concrete skills that you use during the day. That's great. So that's fascinating. And other than your concrete accomplishments, you also now wear multiple hats, multiple administrative hats, multiple professional hats. You fulfill multiple roles and personal roles, as mentioned in the introduction. So, okay, how does this work? Do you sleep? Does your family see you? Do you just have a lot of caffeine involved in your life?
I do have a lot of caffeine. Actually, yeah, I'm here with my mom on duty mug that my dad gave me that has a coffee, and then it came with a companion wine glass, I think, that said mom off duty. Yeah, so I think one of the things that I learned early, again, from a very good mentor who's actually at ATS, he's in the thoracic oncology section. His name's Chris Slator. But he told me I needed to learn to say no a lot more. And he taught me a phrase that I teach liberally, which is, I do not currently have the bandwidth to give that project the attention it deserves, because you are not undermining the project of somebody else. There's so many worthy things to do, but you have to kind of constantly be assessing what you can do. And I think he was mostly like, hey, you're my fellow. I get you for limited time for research. So I want you to say no to everybody else so you can get my stuff published, which is fair. But it's been really helpful. So like one of my podcast episodes is Clean Air and Climate Advocacy for Busy People. And it was based on a talk I gave at Chest called Clean Air and Climate Advocacy for the Busy Clinician, which is, it's impossible. Like there's so much to do. There's so much, work that's important to do. There's so much education that can happen that one person can't do everything. But if you can't take care of yourself and be saying no, to all the times you really can't do something. And it's not because it's not worthy, and it's not because it's not good, and it's not because it's not important. But what you do is you think about why am I here? Where am I where I am? And where can I be most effective? And where can, and again, you have to have your kind of concentric circles of organizing your life, right?
Mm-hmm.
Like you and your, relationship to whatever, higher power, internal commitments has to kind of come centrally, and then your family and your, because like if that immediate circle isn't safe and well, you're not going to be effective, right? So I think you can't sacrifice your family for your career. Like those are things you will end up not having either, right?
Right.
And so it's like you find like, what can I do and how can I serve as my whole self, right? And I think that's a thing that I think is really important, because then it's kind of like putting on your oxygen mask, before you put your kid's mask on, same thing. So, and then you think about like, okay, well, I, care, very deeply about climate change. I see its impact on my patients. How am I affected here? And literally the world's on fire sometimes outside the door. So,
Right.
I can speak more coherently about like, wildfires. So as a physician and a pulmonologist, I can, kind of try to teach people about what the health effects might be, what you can do to mitigate them. And often the people who are like right on the bright edge about it, that's all they can do. Right. And then maybe if you have policymakers, people have like a little more, organizational cloud, or people who can think about, supply chain and trying to decrease the ultimate root cause of climate change. That's really important. But, you can't ask someone like fleeing a fire, to say like, oh, hey, like, is that a diesel engine? Just like, no, just go, get out, So I think there's a lot of,
that's right.
You also have to be like, kind of coming
go
to people
convert
with
to
humility.
electricity now.
Yeah, exactly. That's an EV, it's just like, well, there's no charger. The charger's on fire. So we're using, so I think, kind of coming with a spirit of, this is what I have to offer. This is where my nexus of expertise is. And then being okay, letting go, not doing everything, not being an expert in everything. Like I'm certainly, not an expert on a lot of things, but I think a lot of physicians and scientists and clinicians and people in healthcare get paralyzed by not being the ultimate expert on something. So they think they're an expert on nothing. And that's one thing where I feel like as a clinician, all we do every day is translate the vast mess of science and medical science and research and like all these things we understand into practical reality in everybody's life. And so actually, probably everybody at the ATS who is patient facing in any way is an expert in that. And then I would say that probably scientists are also an expert in like, I understand this whole big, giant, messy field that's my niche. And then I still have the ability to explain to somebody else who's in this completely other field, right? So I think those are human skills that computers can't replace necessarily, that, we can have and cultivate and use, I think, to communicate.
Yeah, that's actually, that was actually something I wanted to address. It seems like you really started really working at it in 2020, about the time of the wildfires in Oregon. Is that right?
Yeah, well, that's when I launched the blog. So I'd kind of gotten started in advocacy a bit. So I had just finished fellowship, and I was a member of our Oregon Thoracic Society. So shout out everyone, if you have a state chapter, should join it. And if you don't have a state chapter, you should look into maybe starting one.
That's right.
So that was my first, kind of real, I think I'd technically gone to ATS as like a resident or a fellow, but, you just kind of walk in and, your attending told you to go, and there's like thousands of people, and you just kind of are lost, and you stagger in and out as a trainee, and you're like, well, okay, I guess that's what you do. But the way I actually really got involved was through my local chapters, Oregon Thoracic Society, and I had been put on the executive committee, kind of voluntold for the position while I was looking for jobs, so I felt like I couldn't say no. But so then I found myself on the executive committee when the American Lung Association, who is our longstanding partner, had kind of come and said, hey, there's these bills in the Oregon legislature. I think this was around 2017, where it was another area at time where the federal government was less interested in enforcing or maintaining climate and clean air regulations and like vehicle standards and everything, and then potentially less so on tobacco. And so the ALA had come and said, hey, Oregon is considering raising the tobacco purchase age to 21. And they're also considering some regulation on these diesel engines. Because we actually had this problem in Oregon where California, God bless CARB, was doing all these laws, which were making all these diesel engines, expire basically in the state of California. So there was like this fire sale sending them north to the state of Oregon. So unfortunately, our diesel fleet, I was at very high risk of just getting a lot dirtier. And we have some very vulnerable populations in our, we have a lot of areas that are very vulnerable to diesel exhaust, not just in the Portland metro area or like the metro areas, but there's also these areas where there's frequent inversions and horrific air quality,
That's right.
even in more rural areas. And so the American Lung Association was really encouraging the Oregon State Legislature to really consider, hey, like kind of putting a purchase year date, like a hard like 2007 purchase year date for some of these diesel engines, and then also kind of doing a task force. And so they just said, hey, we'd like to have a lung doctor kind of wander around and explain to legislators about diesel and tobacco. And so I would go meet with legislators, and it was funny because I'd just go with ALA to walk in to anybody, and and they'd say, oh, like, weren't you the doctor that was here about smoking? And now you're talking about trucks? Like, my truckers, we had this giant like glider truck manufacturer in Portland where they just basically take an old diesel engine and put like a fancy new body on it. And so of course that was an employer, and everyone's like, well, why? Like, we don't want to squash any businesses. And I'd kind of have to explain, about diesel particulates, which meant I had to educate myself a lot on it. And the more I learned, I realized, oh gosh, this is pretty bad. And then, but then that's where I kind of came up with the tagline of my podcast of like, don't light things on fire and breathe them into your lungs, and just said like, actually it's smoking, right? We're kind of all smoking, right? So it's like, we don't want the kids smoking when the like diesel trucks are riding by their schools. We don't want our, cause I have so many drivers and truck drivers and construction workers and stuff in my practice. And it's not just like the 2 cigarettes they smoked on their smoke break, it's also this like chronic exposure. So, talking to them about that, and I'm just trying to help them understand, and then when the pandemic, and I'd been kind of toying with, again, being a busy mom, was then I'd get asked to go talk at, a town hall about diesel or something. And that's fine. The only thing is I'm a busy mom and I have 3 kids and, a full-time clinical practice. And so, going and talking to 10 people here or 20 people there, or even, a committee hearing or something, whether it was the Multnomah County, I just said like, hey, I don't want to become like the Lorax that speaks for the trees. And I'm like the one lung doctor showing up and saying the same thing, because honestly, this is very well published. I wasn't reviewing anything edgy. I was just doing like in a big mainstream publication, like New England Journal of Medicine, like stuff like those kind of studies. And so I just said, what I wanted to do was find a way to kind of automate that, or like automate people's ability to speak to it or to kind of understand something without me having to just talk myself blue in the face all the time. And that was kind of, so I've been toying with the idea of, I bought the domain for Air Health, Our Health. I'd been toying with the idea of doing a podcast because I love podcasts. I just didn't really want to listen to my own voice, and I felt weird about it. And being on the internet seemed really weird. And so that had been holding me back. And then the pandemic happened, and I realized I was, just seeing the world shutting down. And I realized, I was worried that ICU doctors pulmonary critical care doctors were basically just going to become ICU doctors, and we were going to have no pulmonary clinics, that clinics were going to shut down, I just didn't know. And I was thinking, oh my gosh, like what would be the most important things, like, especially for all people with respiratory disease. I'm like, well, if everybody could quit smoking, quit vaping, and like start working on cleaning up the air, then hopefully we will need fewer patients in pulmonary clinic and fewer people will end up in the ICU. And that's like the one little thing I could put out into the world. Thinking I was just never going to see the inside of a pulmonary clinic again. So that's kind of what launched it. And it's been going ever since.
That's a big technical jump, though, to take from, putting settings into a ventilator. It's a, how did you learn how to do that? Did you?
Well, I would say learning
to
podcast is way easier than learning pulmonary critical care. So I think if you've learned pulmonary critical care, whatever fancy thing, whoever is listening to this from the EOPH assembly, I'm sure there's some assay in the lab you can do, or some atmospheric chemistry modeling that you can do that nobody else can do. Podcasting is way easier. You plug a microphone into a computer and you hit play. So yeah, this weirdly happened in a different way. Too much information probably. But the other thing that happened in the pandemic is, I don't know if this happened to you, but it definitely happened to me, is one of the flaws of American healthcare is that nobody actually, can keep themselves in the black by, you know, caring for actual sick people who actually need it. Sometimes there's all these like elective procedures and things that need to be happening.
Right.
I mean, critically ill patients, sorry, you know what I mean? Like to kind of keep the engines running, right? So,
Yeah.
if you're not doing all the, joint replacements and, all this other kind of volume that has a much more predictable payer flow, the hospital really starts to struggle, right? So, just only caring for patients who are like critically ill, who often will run up significant, bills. And then, maybe the insurance payer mix doesn't work out for the hospital. I don't actually understand these things. I'm not in the C-suite very well, but I do understand that we sat at a meeting one time where they're like, we're cutting all your pay. And it was in the pandemic, and I was like, wait a minute, I'm a pulmonary critical care doctor in the middle of a respiratory critical care pandemic. Like, my husband's going insane trying to educate 3 young kids at home. I'm worried I'm going to like kill my immunosuppressed mother. And we're getting a pay cut. Like, I don't know what to do. Like, we're like scrambling to like suddenly have like full-time, I was like, and again, and I know, I mean, I'm so privileged because I was getting a pay cut from a physician's salary. And so I'm sure this was happening everywhere.
Yep.
And so I realized, I don't know that much about money. Like, I need to learn about finances. So I went down this like rabbit hole of like listening to all these financial podcasts and reading all these financial blogs. And then I started to notice, I'm like, some of these blogs aren't that fancy, And I was listening to one person who I thought was helpful, who was a physician who did some stuff on physician women finances. And she was like, well, like WordPress is easy. So I just like started a blog and did some WordPress. And I was like, well, she can do it, I can do it. It's not that easy. My website doesn't have a search feature because I couldn't figure out how to get the text correct in the search feature. But that's, the world will be saved by B+ work, right? So that's why my sister who works in computers is like, your website looks really clunky. And I'm like, it's what I can do. And I'm not going to spend a lot of time in figuring out how to make it fancy. And it's free. Like, I mean, it's not free. I have to do the hosting fees and all that sort of stuff, but I don't have to pay for anyone to do it. I mean, I'm sure I could update it, or I'm sure I could hire somebody, but I mean, it doesn't make any money. So I'm not going to pour more money into, like, mostly it's just, figures and references about studies on air pollution.
Yeah. Well, but you do this all your own. I mean, I'm fortunate. I have ATS backing me up. Who are the people you're speaking to when you're creating your podcast?
Yeah, I try to keep it for a general audience. And that can sometimes be challenging when I'm having, highly technical, like expert people on, because, sometimes people can kind of go into jargon. But I do try to keep it for a general audience because I mean, honestly, a lot of the people who listen are my patients, because they'll have a gas stove and I'll say, well, we have 15 minutes. I can't launch into all the nuances of a gas stove. But here's an episode with Laura Pollen, who is an expert in the ATS EOPH assembly about gas stoves. And here you go, right? Because the other thing is you have to help meet people where they are. They're just going to tune you out, right? You can't just say, you must go to your landlord and insist that they rip out the gas stove and install an induction. And you know what I mean? Like, it's just not, it's not real. So it's like, there's things you can do if you have a home with a gas stove. And the patients who should know about that are the ones with their airway disease, because they may not know it's an issue. They may learn a little more. And I think there's also, the more you kind of understand something, the more you can just do common sense things, right? You can open the window if it's not too cold outside. I mean, you can just, I think that's where the idea of air health, our health, like this is really the stuff we breathe in and it comes into our bodies and changes our bodies and our chemistry. And I think the more people can generally understand that that's an issue, and then they can kind of adjust things themselves. Because that's one of the reasons I kind of focus on the trigger diary and talk to people about Twitchy Airways and just saying, like, I know it seems kind of cheesy, but you are going to get much more insight living your own life if you start to pay attention to kind of what's setting you off, than like me in a 20-minute clinic visit. Like, I'm just not, I don't live with you, versus, honestly, I think home visits are actually, now that telemedicine is covered and hopefully that continues. I mean, I find telemedicine visits sometimes with my patients very helpful because they'll be like, oh, I don't smoke. And I'm like looking at 3 cigarettes, floating in the background. And they're like, oh, no, that's my husband. And you're like, okay, well, all right, time to talk about secondhand smoke, So it's, there's a lot you can do, or, you can say, show me your HEPA filter. And, they show it to me and I'm like, well, open it. And the plastic's still wrapped around the filter. And you're like, well, let's take that off, or they'll show me the box that's not open. I'm like, it doesn't do anything until you plug it in,
Or it has ozone in it instead of HEPA.
Oh, yes. Or it's got an ionizer and ozone. And the other thing is, one of the ways I pick episodes is like, I don't understand something. And I think that's the other thing is I try to be I think it's okay to say you don't know and just be like, I don't get this. Like, I remember when the pandemic was happening, and there's like ion wave and plasma wave and like all these like things were coming out, and people are like, what's about that? And I'm like, I don't know. And so, but there are people studying them, and what has been found so far, raises some concerns. But again, look, we can use the things that we know work. So.
Yeah. I mean, I actually was looking quite a bit into the Twitchy Airways club, thinking, wow, I'm going to steal some of this.
Steal it. Yeah.
Yeah. Or
The
send
lawyer
my
from my
patients to
website.
your site.
Do it. Yeah. So I'm totally fine. People can like, there's no, I don't actually, none of it's copyrighted. So my lawyer, I remember, because it was funny. I initially wanted to set it up as a nonprofit. It was a .org. And so I talked to all my friends who'd like been involved in starting nonprofits, and they're like, oh my gosh, if there's any way you could make it not a nonprofit, like you're going to go insane. It's just such a pain. And then and so I was talking to this lawyer, and he said, well, what are you trying to get out of it? I was like, mostly like, I don't want some like Philip Morris, astroturfing something through some like local corner store to like sue me and try to take my house or something, And he was like, hey, I just need an LLC. So it's technically a for-profit company, but I donate anything that comes. I mean, I lose money on it, I guess, every year because of like website and hosting fees. But anytime I get like a speaker fee or something, I'm like, oh, there we go. Like, or I think I sell like sweatshirts and mugs and stuff like that. And then I donate the proceeds to the American Lung Association. But I think that
that's great.
My lawyer says that counts. So, but he was saying, well, we need to do copyright or stuff like that. And I was like, my dream would be if people go like steal it and disseminate it. I mean, you could. So I was telling people, I'm always saying you could just take the audio from any of my podcasts. I've told ALA and ATS that if you just want to like repackage them up and ship them out to some other feed, go nuts.
Well, that's
points to spread the word.
Yeah, and you know what? This is, I mean, my younger patients would be all over this. Now I have a lot of geriatric patients. What do your patients say? I mean, do they have feedback? Do they like it?
It's a similar spread. So I have some patients who will like listen to all of them, even ones that don't really apply to them. But usually I'll just ask people, because we live in, Oregon, which is like OPB territory. So I'll find, it's not like an age thing. I'll often find, 80-year-olds who regularly listen to podcasts and are delighted by it. And then I'll find, younger patients who are like, what's a podcast? I do. Are you on TikTok? No, I'm not on TikTok. Although I've been told I should get on TikTok anyway. But I'm just like, I've only got so much bandwidth. So it's not really age. You can't really rely on age. Sometimes you can tell based on the phone someone pulls out in a visit. My flip phone havers are probably not advocate, but sometimes they are. So I'll just ask, I'll just so I put it like a link in my after visit summary to like, different episodes and stuff. And I'll often just ask like, are you, because not all the podcasts are necessarily for them. I mean, although I guess everyone could be a cleaner and climate advocate. And I've definitely had patients who are spontaneously very into advocacy, especially as they've recognized, how things might affect them, and so, sometimes I can just say, you can kind of scroll through episodes and, if you have a gastro, for example, or if you, are vaping or using e-cigarettes, or, I've had patients who've had e-cigarette lung injury, and I'm like, well, find those episodes, you can share them with your friends, And so I think it's just helpful, to spend a lot of time doing like a 20 or 30-minute educational thing that you can then just share. And I mean, I can talk very quickly, but if I just like repeat the same thing over and over, and, get blue in the face, I guess.
Well, I mean, I show videos, like sometimes I have to run off. I have to run off and get supplies for my patients. Here's 3 sputum containers and a flutter valve. And so I just put on a video for them to entertain them while I'm gone.
Oh, that's a great idea.
And they are like, oh, they usually it's like how to use a flutter valve, but sometimes it's other things. And so there's little things. Also, my fellows use when they have to go staff with me. They'll actually put on videos to entertain this is where I got the idea, actually. They put on videos that their patients can watch while they're off waiting in line to staff.
That's super smart. Like from American Lung Association or something, or, something on. Yeah, that's a great idea. I'm going to start doing that. I mean, I don't have to go staff anything, but.
Yeah, or run off. I mean, you might have to run off.
Or while they're waiting for an X-ray or something. Yeah. That's a good idea.
I give credit to my fellows. They're the ones who came up with it.
All right. Good job, fellows.
Yeah. What would be your first step?
Thing that can be really hard is feeling like you have to do everything, and realizing that, even just taking 15 minutes or 10 minutes, in whatever time interval you can do can actually have an outsized influence.
Mm-hmm.
And so I also think the closer to where you are, the more powerful your impact will be, right?
Mm-hmm.
I think a lot of times people think of advocacy and they immediately think of like the federal government or like the global, and they're like, well, I don't have any, or, Greta Thunberg or something. They're like, well, I don't have this like global reach and all this stuff. But you can actually do a lot where you are, right? So I
Mm-hmm.
think that's where kind of getting familiar with what are the laws that regulate the air we breathe, right? And what are and the thing is, and you're going to know your community better. Like you're actually already an expert in your own community and what its values are. Because one thing I have learned, one of my favorite podcast episodes I did was with a behavioral scientist on understanding, people who, are concerned about vaccines and how to
Mm-hmm.
talk about vaccines. And that episode really changed the way I approach it because a lot of people are more interested in shared values. And the nice thing about being interested in clean air and climate advocacy and helping decrease tobacco use and helping people break free of nicotine addictions is
Mm-hmm.
there's very little downside. Like there's
That's
very little
right.
downside to helping people quit smoking. Like there's not many bad side effects from helping people quit smoking or quit vaping or, to have less pollution in the air, right? It's generally really, really going to be good, right? And so, and the thing is, there's a lot of low hanging fruit, right? So I think a lot of times
Yeah.
people are, think the minute they have to talk about cleaning up the air, you're going to like be taking the one family car away from a family who needs it to commute. And it's like, no, 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 no. Like, how can we help with, kind of like idling rules, or how can we make sure there's more, bike lanes and, chargers in areas that are dense enough to have that happen? And you can do a lot even outside of regulation, right?
Mm-hmm.
So right now is maybe a time where people are nervous about getting engaged in government or getting, just there's, people, you should recognize what your personality type is and what you're comfortable with, and then do things that align with that. Because I think sometimes people picture advocacy and they picture, marching in the streets and, doing all the stuff that doesn't feel right. But advocacy is really just carrying your voice, right? So that's what it means, right? Is you're carrying your voice and you're carrying the voice of your patients. So
Mm-hmm.
whether it's, showing up, or if county's considering banning, gas powered lawn equipment, or even not even banning it, but just helping with a program to incentivize transitioning to like cleaner, quieter options, you can
Mm-hmm.
just show up and say, like, let me tell you what these particles do to people. Like, let me tell you that, running a gas powered leaf blower for 30 minutes is like, driving a Ford F-150 from Texas to Alaska, right? Like, that's a lot of pollution in a short period of time, compounded on the people who can least afford to be breathing that pollution.
Right.
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 And so it's like you can do that and explain it, in normal language, which clinicians are experts at translating, fancy science talk into like, don't light things on fire and inhale them, right? And you can just say like, and then it's like, better is good, right? So it's like if right now everyone's using them all the time, all day, every day, it would be better if half the people were, using gas equipment, or if there were more electric options available, and there's just different ways to engage that may not be so scary, because I think people get scared when they hear advocacy, or they think of just form letters. You know what I mean? Where it's like, oh, I'm just clicking on the box to like add my name to a thing.
Mm-hmm.
But the other thing to do is, even I also really think you should talk to your most local elected official, because they are probably someone who is overworked and wants to make their community better. They're probably not getting paid a lot. I mean, it depends where you are. I'm sure there's, variance on this, but it's like your county commissioner, your, your city council.
Mm-hmm.
Because I think sometimes we forget that people actually live in cities and communities, right? And towns and whatever. And air pollution is generated, I mean, it's generated all over, but there's a lot generated locally. And so if whatever you can do locally to clean up the air, or, get environmental toxins, out of the water, out of, anything. That's really moving things forward. And people are much more responsive to something that's local and that they can understand. One of the podcast episodes I did was this year with Tony Gerber from National Jewish. He became involved in air quality in his state of Colorado and became a resource for them to help understand how to, make the air cleaner and safer for the communities at the state level. And he, would talk about examples of, very politically, diverse, or, communities, or even communities that seem that, politically has not seemed to historically have much of an interest in, air quality. And they even, kind of came together to shut down a coal plant because they recognized it was making their kids sick, right? So I think a lot of the times we assume in advance that people are going to resist something at a level that is just actually not the case, because most people want their kids to breathe clean air and drink clean water,
Right.
right? Um, And I think coming together as like community can be pretty potent. Another podcast episode I did was with Catholic Climate Covenant, right? So they actually are going around trying to help all these different churches, you know, install solar panels and help, you know, kind of move, you know, really take climate on as an environmental justice issue, which was, you know, something that had become increasingly a focus of the U.S. Catholic Conference of Bishops and
Hmm.
most famously with our most recent Pope. Um, uh, and so, you know, they were kind of taking it on that way. You know, they just did a pilgrimage to take copies of Laudato Si, which is this climate encyclical to all the Catholic members of Congress, right? So, and that exists in multiple faith traditions and non-faith traditions. And, you know, this is just a thing where there is a version of it close to you if you just can find it. And then that's going to be something that's most satisfying to you in multiple dimensions, right? It's something you can bring your kids to. You can be active there. You know, I brought my kids to a climate protest on the steps of Washington, D.C. at ATS one year, you know? So it's just like bring your whole self, bring your family, and then it makes everything more sustainable. And then you're going to have
Hmm.
more of an impact if people know you, right? If you're actually taking an impact in a lead where you're known, um,
That's
I
right.
would
Talking
say.
to your neighbors.
Yes. Yeah,
Yeah,
exactly.
yeah. Because they know you. They see a
Yeah.
multi-dimensional person rather than
Yeah.
just this Facebook post or this
Yeah.
post, you know.
Yeah. I would say very limited utility probably in doing it all on Facebook and social media.
Right. All right. Now this is a little bit outside of your general expertise, but I think you probably have some good opinions. You wrote on your website that you did not learn enough about the importance of clean air in medical school residency fellowship. What can undergraduate and graduate medical education institutions change to better improve air pollution education?
I think I'm hoping I'm hearing more that it's starting to change, but I think, you know, I honestly think it should be something in pretty much every module of med school because climate change is just one of the biggest global threats to health right now and peace and
Hmm.
national security, all sorts of things. But I think and then understanding how things are going to change over time, I think is helpful. So, you know, if you're doing the allergy section, understanding how like pollen and, you know, is changing with carbon dioxide and heat, you know, increasing, you know, understanding that, you know, heat stress and, you know, cardiovascular outcomes, especially as climate emergencies are happening more. I think there's a real, it's not just a long-term thing, it's a short-term thing, right? You need to know how vulnerable your patients with cardiovascular disease are to heat events, right? You need to know how vulnerable they are when there's, you know, to your respiratory patient. So,
Hmm.
you know, unfortunately right now, it kind of seems like it's a lot of the times it's student driven or learner driven, which really does risk, which is great. I mean, it's better to be driven by somebody, but it does risk, you know, maybe having holes that we don't see versus if someone's kind of taking it from like a systematic global standpoint. So I'm hoping it's something that, you know, program directors and fellowship directors will take on and take more seriously. And I know there's members of the ATS that are working on this for the pulmonary critical care community. But my advice would be learners really want to know about it. And I think one of the things that's a little bit of the sociology of medicine is attendings and professors want to be experts. And so they feel a little uncomfortable if they didn't learn about it, then how can they teach it, right? And I think
Yeah.
this is one of those things where it's like you just got to roll up your sleeves and learn about it. Like there's plenty of
Right.
learning, and then teach it.
Yeah.
You know, see one, do one, teach one, or you know maybe. And so I think I do really think it's something that you know because I think sometimes when you're really busy and you're coming out, you're like, well, I didn't. No one taught me about it, so it can't be that important. And I think we need to kind of flip that and say, hey, this is important. I really need to learn about it so that I
Hmm.
can be effective. And I think the other thing that really happens in the Western medical model is that we often put all the burden of maintaining health at the individual level. And so we also just look at it's individual behaviors that determine health, right? So that's why we focus a lot on like eating and smoking and all those things are super important, but there's so much environmental, there's so much of like where we grow up that really determines our health, right?
Right. Hmm.
And I think, we classically think about things like lead and other forms of pollution, air pollution, but even, like social bonds, right? I think, and again, loneliness. I think there's a lot of stuff with like loneliness being a massive crisis right now. So I've actually got a loneliness stop phrase for my patients who are kind of alone and, working on, trying to help connect them
Hmm.
to other members of the community, which helps in a whole host of ways. So I think that's the part where I think we also need to look at our, we're rugged individualists in America, which is, part of our charm, I guess. But on the other hand, it really is distorting
Yeah.
because, we really can't, you can't separate yourself from literally the air you breathe and the water you drink and the food you put in your body. And so we do really need, and I think that's also something that is not as politically black and white as I think people think it is, right? I think there's a lot of people that share that belief and they come to different kind of conclusions, or they make different enemies or allies or whatever, at the upper level. But the more you can just bring things down to a specific problem and avoid slogans or isms, right?
Yeah.
Or this
Or
is
the
this
30
ism or
seconds.
that ism. Yeah. Rather just being like, okay, I want there to be less, carbon monoxide and particulate matter going into the lungs of my kids. Like,
Right.
I want there to be less lead. I want there to be less plastic in our water. You know what I mean? Like, and then you can have people who you would probably wildly divergent views on a whole host of other things can maybe come together to work on that, which could also potentially be a bridge to coming together on other things.
Right.
In the Pollyanna view of things.
Well,
but you have to have hope, right?
You have, yes. If you don't do anything because you're feeling like this is already a lost cause, then nothing happens. So
yeah, and doing things actually makes you feel better. It's also good for your mental health.
That's right. That's right. So multiple reasons. And so if anybody wants to learn more, they can look into Allied Twitchy Lungs Club, which you heard it here first. Anybody's welcome to steal. And finally, just keep looking into the Environmental Health Policy Committee and what they've been producing. And Dr. Moseson is involved with that. And we also look for greater things from you to come. Thank you so much for all of your work and for all of your enthusiasm. You really are an inspiration.
Well, that's very sweet. I go into the EOPH assembly and I have this massive, imposter syndrome because I'm looking at all these amazing people doing all this cool research, and I'm just following them around with a microphone being like, can you talk about it on my podcast so I can understand what you do? Because it's really cool.
No, it's important. You're the person, you're like the researcher whisperer and getting it all out to everybody else. So this is very important. Thank you so much.
Okay. Well, thank you very much. It's an honor to be here today.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more podcasts from the ATS assemblies on YouTube. Don't forget to like, comment, and subscribe so you never miss a show.